Hi guys, the NHS must reform or die. Now, that was the response from the Prime Minister Keir Starmer to a report that described the health service as in a critical condition. So it'll come as a surprise to nobody that the NHS's ability to provide a level of service over the last 14 years has declined dramatically. Before the Tories took power, for example, there were 2.5 million people on the NHS waiting list. It currently stands at about 7.5 million. So Starmer is going to say that it needs to reform or it will die. Have a listen.
The dire state of the NHS has been laid bare in a rapid review by independent peer Lord Darcy, who has described the health service as in serious trouble. Well, Matthew Thompson joins me from the Department of Health. Weeks it's taken to carry out this review and ahead of a speech by Sir Keir Starmer tomorrow. So what have you learnt, Matthew?
Well, you say dire. I mean, dire is almost putting it mildly. This is a devastating assessment of the state of the NHS, frankly, which the report says is failing on its most important promises to the British people. So on waiting lists, on A&E, on cancer and cardiac services, on access to GPs, on maternity services. I mean, the list goes on. It describes crumbling buildings, outdated machinery, outdated systems. It describes exhausted and disengaged staff. And, you know, it frankly ultimately concludes that the NHS is, in the words of the report, in a critical condition. But it does offer some prospect for fixing it. It's not entirely doom and gloom in its 140 or so pages, although mostly so. And I think its conclusions are likely to dominate politics, certainly until we break for recess on Friday, and probably long beyond that. You mentioned Keir Starmer is going to give a speech tomorrow in which he says that the NHS must now reform or die. So pretty strong words. And the report offers some explanations for why the NHS is in the state that it's in. The aftershocks of the pandemic, perhaps an obvious one, but it's also highly critical of the structural reforms undertaken by the coalition government after 2012. And it also is critical of austerity, the lack of capital investment over that same time frame. And it concludes that Britain is effectively a sicker nation than it was a decade or so ago, and that's put extra stress on the NHS whilst it's trying to deal with all of those other challenges. Now, Keir Starmer tomorrow will, unsurprisingly, put the blame squarely on the Conservatives, as he's done so many times over the last few weeks and months, but he will say that he has a choice: either raise taxes on working people to fix it, which he's not prepared to do, or reform and modernise the NHS. And Labour, he says, or will say, are working on a 10-year strategy to do just that.
Okay, so let's start off with the first point. You know, if the service has been underfunded, then reform is not going to fix that. It needs an injection of cash. Now, there is the possibility that you can move money around in that sort of way of reforming, but we all know that the NHS needs more funding. You need more funding if you want to hold on to staff, for example. So this idea that they're not going to raise taxes, they're going to have to raise taxes if they want to rebuild the NHS. It's not just a case of reforms, and reforms need to take place, but it needs huge amounts of capital. Now, mentioned a few things in the report: crumbling buildings. You know, there are people having operations where there are pillars, there's metal poles holding up roofs, holding up ceilings, and there's a risk that some of these ceilings will collapse. This is insane. This is because of Tory rot, outdated machinery, outdated systems. These are political decisions that the Tories took. We're not going to invest sufficiently in the NHS. These systems cost a lot of money. This equipment cost a lot of money. The Tories were not interested in spending that money to update these systems and update the machinery. Exhausted and disengaged staff were also mentioned here. You know, the Tories have been picking fights with the trade unions for ideological reasons. It was junior doctors' pay freezes for years because the Tories decided we would prefer to have arguments with them we would prefer to pick fights with them than to actually pay them decent wages and improve their conditions. And we saw the result of that. Strikes and doctors and nurses leaving Britain to work in Australia or Canada. Now, the reasons also austerity. This was a political decision. There was no economic argument behind austerity. This was the Tories and the Liberal Democrats when they took over in 2010. A political decision to run public services into the ground, to cut funding for public services, and to have a smaller government. So, as was pointed out also in this report, lack of capital. So once again, the Tories in particular decided for political reasons we're going to have a smaller NHS. We're going to force the NHS to work with less money, with fewer staff, and this will, of course, force more people into the private sector, because that's the goal of the Conservatives. Now, what is Labour going to do about this? As I mentioned at the beginning, they will have to raise taxes, they will have to borrow, they will have to find some way to refund the NHS, because it has been underfunded over the last number of years. And a lot of the reforms that should take place is a redirection of money from the private sector back into the NHS, because this is a serious problem as well. The role of the private sector in the NHS, because it's draining money away from public services. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.